Do you want to start with your intro, and then we'll kind of get into the
Sure.
organizational intros in a couple minutes and some slides, but why don't you introduce yourself?
Sure. So I'm Denise Mariano. I work at the partnership. I am the director of family support and advocacy, um, but I'm also a family in recovery and whose journey began on advocacy. So I am so excited to share. Um, Families make your voices heard, right? I was one of those that didn't know if my voice was worthy of being heard. So I'm really looking forward to today.
Marcia, do you want to introduce yourself?
Sure. Thanks, Erin. I'm Marcia Lee Taylor. Like Denise, I'm also with the Partnership to End Addiction. My role at the organization is the Chief External and Government Relations Officer. And I have been with the partnership for about 16 years or so. And before that, I spent 11 years working on Capitol Hill. And I would watch all of my colleagues who covered different issues. I worked on addiction issues. I would watch my colleagues who covered other issues have legions of families and advocates telling their personal stories come through our office and come through the halls of Congress. And I thought maybe someday we'll have that in our field. And I'm so delighted that we have it now and that we're able to talk about how to make our voices heard as a community working together at this webinar today. So thank you all for coming. Erin?
Thank you. It's so good to see you all here. I see some familiar faces. I see some new faces. Welcome. My name is Aaron Kaczarski. I'm a person in long-term recovery, which to me means that I haven't had a drink or a drug since September 6th of 2003. And I work with Recovery Advocacy Project. I'm going to talk a little bit about the organization in a minute or so. But I really got into this work because I've been doing community organizing sort of work since I was 17 or 18, for environmental groups or labor groups, social justice organizations or political campaigns. And I've really gotten to see that change that when we build relationships within our communities. And I got into recovery when I was 22, and it took me about 3 years to start speaking out about my recovery. I was very private about it for a long time. And once I kind of combined community organizing with recovery, I feel like I had found something, to give back to communities and to get to know people that were impacted by addiction in one way or another. And I'm especially happy to be working alongside Marcia and Denise, because there's a number of times last year where Recovery Advocacy Project would do a town hall or a listening session or a training, and we'd have family members come to those trainings, and they were never really sure if they were like supposed to be there, and we always want family members in on the issues that we're working on. When I personally say I advocate for the recovery community, in my head that means people in recovery, family members, and all of our allies. But I need to say that every time, just to make sure people understand that, it's not just people that are struggling with addiction or are maintaining recovery that are impacted. It's family members, it's whole communities, and it's a lot of allies. And so welcome everybody. It looks like we're still letting people in, but just to clarify for everybody, the chat is off. If you have questions throughout the webinar today, you can chat the hosts, and your questions will come to the hosts, and so that way we'll have questions at the end of the webinar. And then there's also a closed captioning live transcript button at the bottom. So if you need captioning, you can turn that on. If you don't need it, you can take it off.
Hey, Aaron, just to piggyback, I can't thank you enough for saying how you found the partnership and the whys behind it, and for all the families, right? I mean, I think it's for far too long that with the negative stereotypes, we thought that we were part of the problem when in fact we can be part of the solution. And that includes in our advocacy work. And I'm so grateful for this. So for the inclusion of families and that our voice can be heard, right? Because we have different needs and unique needs. And while we are lockstep on a lot of our advocacy efforts, I think this is a great opportunity where we can also help educate the recovery community on the unique journey travel and the unique hurdles. So I want to thank Recovery Advocacy Project for that inclusivity of families and really us being a voice out there as we advocate together. So thank you, Aaron, for bringing that up.
Well, thank you. And we're just going to focus on some basics of community organizing and advocacy today. I'm sure Denise and I will have a couple stories of us advocating together. And we're going to talk about some tools that are already available from organizations for all of you as family members. All right, Garrett, can you go to the first slide, please? And Denise and Marcia are going to talk about partnership.
Yep.
Great, thank you, Erin. So the Partnership to End Addiction is a new name for two old organizations that have joined together, the Partnership for Drug-Free Kids, also known as the Partnership for Drug-Free America, and the Center on Addiction. So we have about 30 years of experience under our belt from both sides of the house. And we came together about 2 years ago, really to put families at the center of all that we do. Our mission is to transform the way our nation addresses addiction, but it really is by focusing on families and caregivers as agents of change. And it is in our nature to partner. It is in our nature to want to raise families' voices and make sure that on the advocacy front, we're keeping families at the center of everything. And we'll hear a little bit later about how how your stories really keep policymakers engaged on this issue and make sure they understand the nuances of how policies affect families. So thank you in advance for helping us to lift family voices and to help shape public policy. Aside from policy, just for a second, we also have on our website, drugfree.org, a wide range of resources for families to help offer support and guidance wherever they are in the continuum. Everything from a toll-free helpline to a Hope and Help by Text program, which offers curated text messages, to a legion of science-based resources on our website. So I encourage all of you who haven't come to drugfree.org to check it out at some point at your convenience.
Right, next slide
Go
there,
to the next
Garrett.
slide.
Thank you, Garrett. And so I'm just going to talk a little bit about Recovery Advocacy Project and who we are, and a little bit about who we're not. So I really don't think of Recovery Advocacy Project as an organization. I mean, technically it is, but it's really a project of a network of individuals, of grassroots advocates working to help one another. Really everybody in this space, whether you're a family member or a person in recovery or a harm reductionist, an activist, has something to offer and to teach. And so it's really a network of individuals learning from one another and empowering one another across the country, advocating for addiction recovery policies. We're committed to giving people in recovery from all pathways, family members and supporters of recovery, and people that provide recovery services, the grassroots organizing tools to think and act locally. And I think that's a little bit of, in terms of an organizing philosophy, one of the differences between some of the national groups and Recovery Advocacy Project. The work that groups do on the federal level, both family groups and recovery groups, have a huge impact. There's some amazing organizations, including Partnership. that people can get involved in. I'm sure some people on here are involved in some of the national organizations as well. Our sort of, we really stay in the lane of thinking and acting locally, so we really focus on the impact we can have in our communities and in our state. And we rarely go outside of that we rarely do like a national action alert. A lot of the actions that we do tend to stick on the state level. And so we're working to build a visible and effective constituency that's in demand of both community and public policy. So it's community and legislative based solutions around what we're hearing on the grassroots. And one of the things that I like to talk about, I ran an advocacy program in New Jersey from 2010 to 2018. And we had between 10 and 12 volunteer organizing teams in the state. So it was really my job just to drive around New Jersey and from community to community, county to county. And one of the things that I learned in that experience, and Denise has similar stories of this too, is, there are issues that bring us together on the state level. There are issues that bring us together as family members and people in recovery. There are issues that bring us together on the national level. But when you really look at from county to county, from community to community, and you ask people their experiences and the barriers that they're facing, that really changes, and I think for me personally, as a person in recovery, I live in Myrtle Beach, South Carolina. What was important to me and some of the experiences I was having as a person in recovery 6 months ago was different than a year ago, was different than a week ago. And so we do have a focus on working to keep things grassroots guided. And so a lot of the times when people ask us, hey, where does RAP stand on this issue, we don't have a blanket answer on a lot of those issues because it differs from advocate to advocate, from community to community. And so that's a little bit of a difference of organizing philosophy. But whether you want to have an impact on federal stuff down to the grassroots or grassroots up to federal issues, there's a place for that. And so we're going to talk about a lot of different ways that you can get involved in one or the other or both today. Yep.
Yeah, and just to piggyback on what Aaron said, I think we're going to share on a later slide, some of the work we've done together. But both federal and state, how they're both critically important, right? Maybe those grassroots level, advocacy efforts really model, the federal and inform that federal. And so, and Aaron and I will share a story later of how we got together at the local level, but how our work at that local level and grassroots level really informed and helped bring about many different laws that came through, whether that was Good Sam or naloxone laws. So super excited to share that with you. Thanks, Aaron.
Yep, there's plenty of examples of it going both ways. Yep, amazing. And so one of the things that I wanted to talk about, we say advocacy a lot. And there's some similarities between advocacy and community organizing. And I just wanted to put this term out there for people if you all haven't kind of heard of that. But community organizing differs a little bit because for me, a lot of it is about relationship building, having shared with people that have similar sort of values and visions in and around your local community. And advocacy can be a result of that community organizing. So this the coordination of cooperative efforts and campaigning carried out by local residents to promote the interest of their community. And so I just wanted to make sure that we put that definition out there and that sort of concept out there as well, because advocacy and community organizing can complement one another. When I think of advocacy, I think about having somebody write a letter to their elected official. When I think of community organizing, I think about, well, there's a local issue, who is the person, who are some of your allies that you can meet up with? what is some of the messaging that you can come up with to solve that problem in your community? Who are the people you need to advocate to? Do you work with media? Do you have letters to the editor? What is the organizing strategy with the local residents to get social change? So I just wanted to put that out there as we're moving forward. And Marcia and Denise are going to talk about advocacy.
Yeah.
Oh,
hey,
sorry.
Aaron, this is your stats page, which I'll definitely,
Yeah.
I want to let you have the opportunity to serve this up. But in everybody attending today, especially the families, when you think of community organizing, there was a time, not so long ago, where both families and people in recovery were doing really important work together. But what's really wonderful now and why we're making so much progress is that our two voices are coming together. So when you think of community organizing, think of what Aaron just said, but think of the different messaging that can go out and how important the family voice is too. We just have a different perspective, a different journey. And as Marcia mentioned earlier, our stories, whether on a working team or at a bigger level, are really critical. So, so thanks for that.
Thank you. And I think a lot of, yes, thank you. And thank you for reminding me of the next slide. In my head, they were out of order. And I think a lot of times when we're doing advocacy work or community organizing, it's really easy to, we don't always see how it adds up, and advocacy and community organizing can be frustrating, and sometimes we can feel like we're in this alone. And I think part of our message today to all of you is that you're not alone in this fight, and there's people that will work beside you and with you in what you're working to accomplish. So next slide, Garrett. I'm going to take about 30 seconds on this. So we have, we're really in only our second year recovery advocacy project, and so we're very young. We got to learn from some things last year that didn't work, and so but we also got a lot done. We hosted a lot of town hall events, and these are all done through community teams, through statewide teams. Each state has a state organizing team, and that works to develop campaigns, that works to listen to people, and then works to develop campaigns. And so last year we actually had 13,000 people take actions, whether it's signing a petition or doing a letter or attending an event. We had over 35 trainings, about 28, 30 town halls, and we did a whole bunch of listening sessions first, just to listen to people on the grassroots level. And the listening session was really just a group of people in recovery, their family members and friends, and we just asked them about what's happening in their community, and things moved from there. And so last year we were pretty active in 23 states, and this year we're over 30. We're like between 30 and 35, and then some other states that have some stuff going on, but maybe not on a high level of having a full organizing team all the time. But it depends from state to state. So I just wanted to put that out there. And we can go to the next slide, but that's the sort of stuff that can happen just in terms of just on the community level. That stuff does add up. And I wanted to share, this is one of my favorite slides that I put in almost every presentation, because I mentioned that sometimes, advocacy and community organizing things can get stalled. It can be frustrating. And I always think of this is from Wellstone Action. And they talk about the 3 aspects of social change. And if 2 out of the 3 of these things are working, then if you have all 3 of these things, is what I meant to say, working in harmony, then you start having those social change. And so on one side of that triangle, it's the idea and the policy. Somebody here has an idea. On the second side there, then you need decision makers to vote on it, or if you're working towards something with law enforcement, maybe the decision maker is the chief of police or a prosecutor, or attorney generals, and then you need that grassroots component, that third, that's the people component. And so if you feel stuck on something that you're fighting for, most likely it's one of these three things, right? There's something that you either need more votes from the decision makers, or you need a grassroots push, or maybe you need to tweak the idea. Maybe not, people aren't like ready for the idea that you have or the policy that you have in mind. What's a halfway step you can do and advocate for to get to that policy? So I just wanted to put that up there. And so this always helps me when I feel like kind of stuck in my advocacy efforts and somewhere. And so we try to relay this and teach us as much as we can. Again, that's from Wellstone Action. Next slide. And I'll leave the what is advocacy with Marcia and Denise.
Denise, I think this one is you. Oh, you're on mute.
You're on mute, Denise.
Yep. Sorry about that. So what is advocacy? I just, before, so often we do these presentations and we read from the slides, which I might do in a second, but this slide was very important to me as a family member, and I hope I can share some, personal thought on this. For a really long time, I just thought like advocacy wasn't achievable for me as a family member, right? I was confused by what is advocacy and what is policy. Does my voice really matter? And how important that voice is, right? So Marcia mentioned sharing your stories. So why I'm so grateful to be part of this presentation, because I think we can spell that out and understand, especially as family members, that there are many different voices. There's that, loud megaphone, and there's those of us maybe that are quiet behind the scenes, and also different advocacy levels, which Marcia will speak to later. So what is advocacy? Advocacy is making a case for cause and building support for an issue among the community, elected officials, and the media. It means providing a voice for the community by educating and influencing people about policy topics, and especially in the climate that we're in today. And I think it's going to probably be the landscape going forward. That doesn't mean that getting involved in advocacy means going to Washington and sharing our stories. We'll talk about different lifts later, but maybe that means just, doing a social media post or attending a town hall, or maybe that means just really joining other communities like we are today, instead of working in silos and maybe agendas, coming together. But there's many different flavors of advocacy. And I know it might sound cliche because we see this, quote all the time, never doubt that a small group of thoughtful, committed citizens can change the world. I know from experience, I know from talking to hundreds of thousands of families that this really resonates. And I think I mentioned before that sometimes as family members, we think we're not worthy of being an advocate, right? Because we're not in the recovery community, or for far too long, we've been shamed and judged that our stories are not important. But I think advocacy can really break down the stereotypes associated with families. So we're going to dig deeper into this as we go through the presentation. So next slide, Garrett. So Aaron, if you want to start this, but we thought this would be a great opportunity for Aaron and I to really share with all of you how we came about, how our lives have crossed. And so I'm going to hand this over to Aaron, but what's not on this slide, and that I would share up front and before Aaron speaks, is all the bullet points here. But when I think of the family advocacy journey, I also think of not being a voice in there for a really long time, right? So we have been we played an important role on changing the narrative of recovery. And what I'm so grateful for, and our families are grateful for our two communities coming together, and super grateful for having the recovery community behind us to help us change what that family narrative looks like. I think so often that families are just misunderstood, and there are those negative stereotypes that we are part of the problem that we need to break down. I don't want to get too personal, but I remember sitting for lunch with Ryan Hampton 5 years ago saying, we got to bring these two communities together. We are so lockstep on so much of the work that we do and the advocacy that we do. My hope and a professional hope, and I know the hope of so many on this webinar, as well as Marsha and Ryan and Aaron, is to bring these two communities together and make us stronger, and we can be more impactful. So Aaron, throw this to you, and then maybe we could riff a little bit how we met and what that looked like.
Yeah, really when when I came to New Jersey, I knew nobody, and very quickly, just listening to people in recovery and family members, and like I said, there was volunteer advocacy teams all across the state, the first issue that I can remember working on that really brought family members and people in recovery together is around the Good Samaritan law that we worked to pass, in New Jersey. And it was a lot of energy, it was a lot of messaging, it was a lot of story sharing, building relationships with elected officials, and that piece about storytelling that you were referring to, Denise, like working to create a culture where it was okay, for people to share their experience with people that were making decisions on our behalf, right? When I think about elected officials, they can either, when I think about my elected officials, they can make decisions whether they hear my voice or not. If they make a decision and I disagree with it and I had my voice heard, then that's really on them. But if they make a decision and I disagree and I didn't have my voice heard, then that's really on me, and so this, wherever you are in your advocacy journey out there, if this is brand new, awesome. If this is something you've been doing for a while and feels like, hey, I could use some extra help along the way and a little boost, that's here too. So when we were advocating for a Good Samaritan law in New Jersey, we went every step of the way, got the bill introduced, advocated in the Assembly and advocated in the Senate, and thought we had the votes, and thought of, and we got it in the State House, and then the bill was vetoed by the governor. And I think there was about like a couple days where we were devastated, but also in this mode of like that can't be the reality, and we fought too hard, and both family members and people in recovery just kept meeting, and we were like relentless. When we had a family member that had this idea to reach out to Bon Jovi, who has a connection to addiction issues and recovery. And, we thought about that and we're just like, well, that's silly. That'll never happen. And then like a week and a half later, we were at the governor reversed his decision to veto the bill. And in fact, they strengthened it through that relationship and by listening to family members. And we were like at a press conference with Bon Jovi and the governor like a week later, and so no idea is too like out there if you want, So, but the reason why it's important to share this story, and Denise can kind of share her piece of it too, is I remember that the governor had said after it got vetoed, he said he got this letter from a mom in New Jersey that she had written the governor numerous times at that point. And I guess the governor's wife read the letter and she turned to him one night and said, "You have to do something about this." And so that, and then, a week later, he signed the Good Samaritan bill and gave that mother the pen, that he signed the Good Samaritan bill. And I'll never forget that, because it was that human connection. It wasn't like, "Hey, here's all the stats on overdose." Like, that's helpful. There's a place for that. But it's that relationship building part of advocacy, and that connection, and when we get together and message with one another. And so, Denise, I'll turn things over for you a little bit too, because I
Yeah,
know that.
so
Yeah.
thank you, Aaron. And I think there's so many important facts to think about there, right? The fact that we never gave up hope, and similar to those of us who have our loved ones struggling, right? That we can't give up hope, and that we have to continue to fight for evidence-based treatment, right? And the story goes on too, with advocacy. And thank you, Aaron, for sharing that it was that story from that family member. We had a couple family members, handwrite a note after, and I don't know if that Aaron shared that this was unanimously passed in our House and Senate and still vetoed, right? And so it took, 5 or 6 of us to really rally those families and those in recovery behind us. And I think for me personally, and I don't like to say me and I, but I think of the we in this, that was a really turning moment for me to get that call at Friday at 5 p.m. and say, you know what, meet us on Monday. We're passing this law, after 2 years. And I attribute that to all the amazing families and people in recovery, and really why we need to work together. It's so impactful that we come together. It's the stories, it's the different perspectives from someone in recovery and those families that travel a really daunting journey. So we share this and we riff here to let you know that our small voices in the beginning was not only impactful, but really helped sign some really important legislation. And I think Aaron mentioned yesterday, while RAP's efforts are at the state level and ours are at the national level, really important that we're working together, right? We can help you at the local grassroots. And I truly believe, and I've seen it happen again and again, that the grassroots advocacy and state bills that are passed really inform the federal level decisions that are made. And New Jersey was one of the first to pass the Good Sam law, and really is a model for other states, and really why it's important as our two organizations that come together, we're able to pass along, state level efforts to RAP and other organizations, and then also they can help us share our work at the federal level. So thank you, Aaron.
Yeah, I like that second bullet point there, that the piece about, like, if we're silent, then we can't create change. And and in that silence, a lot of other people might define who they think we are, and that's not a risk we should take. It's all right to share our story. And I got some chat messages of needing help to share a story. That's going to be our next webinar, just so everybody knows. We're going to go into depth about that. And so thank you.
And Marcia, oh, I'm sorry. And Marcia, maybe you want to just hit upon the third bullet there. That would be great.
Yeah, thanks, Denise. So, there's, as we all know, there's a ton of worthy causes out there, and there's a ton of programs that policymakers need to make difficult decisions about. And it is true that the squeaky wheel gets the grease, and we need to be squeaky. And an illustration of this is a few years ago, I was at the RX Summit, and there was a panel discussion of policymakers, and there was a congressman who heads up the committee that decides all the spending for the Department of Health and Human Services, so all the healthcare spending in the country. And he sort of, was shaking his finger at the crowd, and he said, listen, when we even think about cutting funding for breast cancer, people are chasing me down in the grocery store, and we've got lines of people outside advocating, and our mailboxes are overflowing with mail, with people telling us why we can't do this. When we cut one of your programs, there's silence. you make it really easy for us to cut funding for your stuff. And that was a real wake up call that, we need to be noisy, and we need to be organized. And that's not to take anything away from the other worthy causes out there, but we need to be loud, and make it difficult for people to cut our programs and cut things that are important to us. So just wanted to share that, and as another reason why.
It's a great point, and it's budget season for every state, by the way. So everybody knows. And Denise and I in Jersey, we the budget hearing, the budget committee would have hearings every spring, and people would go and testify, and we just sent person after person after person with written testimony and public testimony. And for 8 years straight, addiction and mental health funding was not cut in New Jersey. Or if anything, it increased in a number of areas, and that's because we made it impossible for people to ignore us. And so I was talking to an advocate last night, and he was talking about how exactly what Marcia just said. He was talking about that, and I think he was in Oregon, I think he was in Oregon. And I told him that example from Jersey. I was like, that can be changed. Like, if that's how it is in your state, and they find it really easy to cut your programs with addiction and mental health, and that you can change that, and so through that storytelling and through that advocacy. So great.
Which is a great segue to Marcia. You have the next slide. Yeah.
Oh, great. So before we mentioned the importance of policy, of sharing your stories to affect policy change. So at the partnership, we talk about our recipe for policy change, and that is data plus stories is what's going to get you change. So you can go into a meeting and you can throw statistics at a policymaker all day. They're not going to remember them at the end of the meeting. They are going to remember your story, and they're going to remember the way your story made them feel. And that's what they're going to take away with them. And that's what their staffers are going to share with their bosses. Those personal stories that really bring to life the data. So I share this with you all just to say, don't underestimate the power of your story, and the impact that it can have, because it really is, you have to have the data, but coupled with the data, it really illustrates it and brings it to life. And as Erin said, we're going to be doing our next session will be all on how to tell your story in a way that can be the most impactful.
We can go to the next slide, Garrett. Thank you.
So today we'll walk through a number of advocacy tactics. And you'll see here on the slide, there's some low lift ways you can get involved, and there's some super high lift ways you can get involved. We're really going to focus on those easy entry points today with social media activity and also action alerts. And in the future, we'd be happy to dig into some of the meatier topics, but for today, we're just going to focus on those low lift ones. So next slide. So as Denise mentioned before, especially in the time of COVID, there's no need to go to Washington or to get on an airplane or to schedule a meeting even to make your voice heard. The Partnership and Recovery Advocacy Project both have super easy ways to communicate with your policymakers about a range of different issues. You don't need to know who they are. You don't need to know what party they're in. You don't need to have counterpoints. It's super easy with action alerts that we both have automated systems where you can plug in information. And I think we can go to the next slide to kind of see how easy it is. So this contact field that we pulled out of the partnerships, but Recovery Advocacy Project has a very similar one. You literally just need to put in your name and your address and your email. And the system will automatically pull up who your member of Congress is, or if it's a local action alert, who your state rep is or state senator, and we'll send the note to them. The note is pre-written. For Recovery Advocacy Project, you can tailor it a little bit. For the moment, the partnerships are just are not editable, but we're probably going to change that down the road so people can add their own personal angle to it. But it literally could not be easier. So both of these are on our websites. What we're going to do afterwards is we're going to follow up with an email that will come to all of you that will show you exactly where to find these on our websites, so that it's super easy for you to access and you can keep track of the different alerts. And if you sign up for Recovery Advocacy Projects action alerts, or sign up for our email at drugfree.org, we are more than happy to keep you up to date as these action alerts are pushed out, so that you can open that email and click a button. And I see a note saying, can we post these links to our social media? Yes.
Yeah.
These are super shareable. Thank you for like the leading question. Yes, these are super shareable. And it's a great way to be a leader in your community, right? To do that community organizing that Erin was talking about earlier, so that we can really build those bridges and say, hey, I took this step to weigh in with my policymaker, you can too. And to share that in social. So that's a perfect way and a nice segue to what we're going to talk about next.
Yeah. Thank you, Marsha. Social media. So interesting that someone just, asked that question. Really low lift, right? We can tag our legislators to make the, we can follow our legislators, we can comment on their posts. And at the lowest lift, right? If you're thinking it's only going to take me 2 seconds to retweet. So to share with some what our families have done, it's also a wonderful opportunity to even share your personal voice. Maybe where we have some legislators working on parity, right? And not everybody knows what parity is. I know from a family perspective, we might not know what parity is until midway on this, touch point, right? And being denied insurance, right? So, maybe it's just retweeting and serving up your own personal message that, no parent should be in fear of losing a child, and no one should put the onus of enforcing parity laws on families, right? So a wonderful way to not only retweet, but to share your own story in a couple of sentences. And I think what's really wonderful about that, sometimes they're watching their social media accounts. And so, yes, we can retweet and we could have the same audiences sharing their view, but as family members, really important that we share our stories, even in 2 sentences. They're going to remember that, right? And remember that so many of our families, like, again, parity shouldn't cause financial ruin upon our families, right? Because we're exhausting our college funds and second mortgaging our houses and so forth. They need to hear this, and we can do that in social media. Remember your followers, right? You might inspire them to also share a tweet based on their own personal experience. And another really important thing that I want to mention, and not one part of one of these bullets here, is just having that opportunity to thank our legislators, right? When a bill passes, when there's some positive outcomes, we're not just there to be hard on them on the legislation that needs to pass, but I think we have to thank them. And I think it's really important that we share the good stuff in retweeting as well. When we think, like today, for example, there's no steady funding for family supports, right? And we can highlight that in 2 different ways. We can highlight it in the horrible, tragic loss of deaths, to really have them relate to what families are going to, but also think as family members to share that good stuff. Maybe you share about your loved one in recovery so that they know the dollars they might pass is really doing some good work, right? And maybe, so again, very unique, very personable. These are some low lifts, but just remember, you could bring your own heart and your own message to social media as well. Okay, Garrett. These were just a few examples of us back in the old days, up on the Hill. I just want to reiterate what both Erin and Marsha said. This has been a really tough year for all of us. It has really changed our work on so many levels, but certainly has changed the advocacy. And there's been really a lot of silver linings. Look at us today, right? We're gathering here on Zoom and having a webinar. And back in the old days, maybe everybody would be so busy or commuting. Our scalability and our reach is so much more. And I think that's very true with our advocacy efforts as well. So again, these are just examples, but I'm really grateful during this very difficult time that we do have a lot of silver linings, and that our work can get out there, and our advocacy work can reach a lot more families and people in recovery. And looking forward to share your stories in our next webinar, and maybe we can touch upon too, and as we go down this road together, what a virtual town hall might look like. And we have lots of great opportunities now. So we could go to the next slide. Okay, Aaron, this is for you.
We do have a lot of tools that are already available for you all, and this will be summarized in the follow-up email that's going to go out, and we'll have links for all of this. We've written at least 9 or 10 advocacy guides, like how-to manuals, whether it's how to do a virtual town hall, or how to testify, do testimony, or how to effectively speak out as an advocate. We have 3 on the way, and so we're constantly adding to that. So we have an online guide that lives at recoveryvoices.com, and then we have a lot of civic engagement tools. We built a vote recovery resource, and so it has everything to register people to vote. You can dive deeper into the issues that impact the recovery community and family members. You can look up who candidates are. You can look up voting history of your elected officials. And there's literally, there's a lot of information on there about voter eligibility, because a lot of people in recovery, state to state, might have laws that impact whether they can vote or not, if they have a criminal record. So all of that stuff is on the vote recovery website. And like, I know for me personally, around election, and this is important for everybody to really think about, vote recovery was really about, how do you make recovery a single voter issue? We know that recovery and the things that impact family members has bipartisan support on a lot of the stuff that we work on. And so for me, as a person in recovery and family members, I shared 9 words with everybody running for office. And I said, this is what it's going to take to earn my vote. And I had conversations with candidates running for office during election season, and that's what vote recovery was about. And so that's in the civic engagement tools. We just built a model legislation page, and this is all state. It's all state legislation and initiatives. Some of it has ballot initiatives or sample executive orders for governors or mayors, and it's searchable by category. So you can look up laws, Good Samaritan laws, model laws, whether it's Good Samaritan or criminal justice issues, criminal justice reform issues, or harm reduction. We work to think of every issue that impacts the recovery community, and tried to find a state law. And so that way, for advocates in states that don't have that law, they can work with legislators towards passing that in their state. So again, this link will be in the follow-up email. We have a social media toolkit. We have I mentioned we have the state organizing teams. So I had a couple messages, somebody saying, how can I get involved in Kansas? How can I get involved in this state or that state? And we're going to share a link in the follow-up email that you can join your state's network. And so if you want to get action alerts that are specific to you and your state, we're going to share a link for you to do that. And then we just do trainings, like Denise had mentioned, and I saw somebody messaged me a couple slides ago about wanting to do a language training and wanting to share their story, and so we do grassroots trainings all the time. We did 35 for grassroots advocates last year, and another 15 for our organizing team leaders in the states. And so then the last thing I wanted to share just in terms of the tools and resources that we have that are available for people. Denise and Marcia talked about their actions alerts, and ours are very similar. We use Action Network, which is it allows it to be a little bit more state specific for us. And so if there's a grassroots advocate that wants to start a petition, if there's a letter writing campaign on a bill that somebody cares about, but it's, it passed one house and it needs to pass the other, you can do a letter writing campaign. Or if there's a legislator that is, blocking progress for the bill that you care about, you can target that elected official. And then it has event registrations. And so our states are capable of doing that. And so that's just another tool we want people to have these tools, to be able to create petitions and do letter writing campaigns and teach people how to do that. Right. Somebody asked, can we be involved in 2 different states? We prefer that people are a part of the state teams that you reside in, but there's certainly, like, if you see an event from another state that you're interested in, you can sign up for the other one. The only problem with the way that our sign up works is that it goes with your zip code, right? And so if you sign up for a zip code for Rhode Island, you're going to join the Rhode Island network. I hope that answers the question and makes sense. So, all right.
Great. And just really quickly on the partnership advocacy tools that we have, you see a picture here of our advocacy toolkit, which walks through some of the tactics we've talked about today and others as well in great detail. And we have action alerts. We'll send out links to both of those places on our website afterwards. But the first bullet is something I just want to highlight. We're really building a national network of family advocates. We now have representatives in all 50 states and would really like to have a deep bench in every state. So really we can flex our muscles with legislators no matter where they are, and make sure that we have a number of voices that can be heard. So again, that's a benefit from signing up and becoming part of our network. Okay, next slide. I know we're running out of time here.
Yeah, so one of the things that we're working on, we're not exactly sure what this looks like yet, because the family members aren't in the family caucus yet. But this might look like the ongoing sort of webinars, and wanted to make sure that there was a space for family members to come together. There's a lot of tools that are continuing to be developed that can be helpful for advocates. And so we're going to have a sign up for like how to get involved in future webinars, and just make sure that you want to stay involved with Family Caucus. And so it's something that's going to periodically convene. We have a inclusivity caucus too, and they meet monthly. This might be something that maybe you all meet quarterly or monthly. It's really up to the family members, and we just want to create a space for family members. And we have a lot of family members that are a part of our organizing teams in the states as well, that join, that want to be a part of the Family Caucus. So again, we're not exactly sure what this looks like yet. We want what it looks like and what its purpose is to come from the survey that we're going to do when we send out the email after this webinar. So there'll be a post survey. And so we want people's input into what you would need out of that national family sort of network that can meet occasionally. And so so this is very broad on purpose. Denise, did you want to chime in?
Yeah, I just want to say how grateful I am to rap for this. I mean, again, I keep on, sending this same message, but to hear you say that the families will inform what this family caucus looks like is critical and really important, and why we have been so successful at the partnership. We have all the brains behind the partnership and the researchers and the PhDs, but what we've learned and what has worked for our families is that we're not just listening to them, we're taking action. And so much of our work is informed by the family voice, the family journey. What are those voids? What are the services that were never, that not there for them? So I just want to say how grateful I am, and at the state level, that this family caucus is really driven by families. And I think it's a great opportunity, not only for them to get involved, but what a wonderful opportunity to help inform and educate the other different audiences and how important their voice is. So thank you, Aaron.
Yeah. Next slide, Garrett. And so we just wanted to put our social media handles up here too. Again, we can probably put some of this stuff in the follow-up email, and so you don't need to jot it down, but it's there. You can find a lot of this by searching for Recovery Advocacy Project or partnership. You can go to the next one, Garrett, or a partnership to end addiction. Some of the handles for Facebook, Twitter, and Instagram are there, and so we just wanted to make sure everybody had that. We do want to leave just a few minutes. I know that we have some questions in the chat boxes, and some of them were sent directly to us, and some of them were sent to Garrett. And so we just want to sort through those a little bit. So if you have questions that we haven't really touched on, please send that to us now. I think I tried to address things as they kind of went. So if you could send your questions through the chat, that would be great. Chelsea had asked, who to contact with to get help in Kansas, to speak out in Kansas, and one of the things you'll see in that follow-up email is a way to sign up for the state-specific. It'll be a link that just says join the movement, and you'll put in your zip code, and that'll put you in the correct state. One question had asked, how close is the missions of RAP and a Recovery Advocacy Project and Faces and Voices of Recovery, which is a great question. I worked with Faces and Voices of Recovery. I have a lot of friends there. I love them. And I think the main sort of difference that, they do a lot of work with recovery community organizations, which is great. I think the focus for Recovery Advocacy Project is focused on that individual sort of empowerment. Faces and Voices does do a good amount of federal actions, which is great. We try to stick to the state and local sort of piece. So, in a lot of ways, mission has some similarities, but just the approaches is a little different. Any other questions in the chats you all see?
Aaron, it's a good question. I don't know if we have the best answer, or you might have like personal experience of this, but when writing like actions that are going directly to legislators, they may or may not read them, see them, email them. So somebody was like, how can you find who may have the ear of that legislator? And it might not be a direct contact with a legislator to get things like that done.
Yeah, and I think a lot of that answer to that lies in that community organizing piece, where it's like, that's the cool thing about getting together with like-minded individuals, right? If somebody knows somebody that can make a contact to a staff member, to an elected official. I know that I trade emails with the chief of staff of my elected official like a couple times a month, just to make sure they know I'm still here. Sometimes it's with a purpose and sometimes it's not. And it turns out like my elected official used to did like exercise classes and with my girlfriend, and I didn't know that, but it's make those connections, right, and build those relationships. And a lot of that sort of stuff gets the coolest thing about advocacy and community organizing is there are people out there that we have not met yet, that we haven't empowered yet and engaged yet. And it's like everybody here is like how when you do a puzzle, everybody starts with the corner pieces and the frame, and then there's that big piece in the middle that those pieces aren't filled yet. and that's the coolest thing about this, is that you can build those connections by putting those pieces together and engaging other organizations, engaging other people in your community, signing up for action alerts, like all that stuff adds up and fits together. So I hope that answered the question.
I was gonna just one more thing that you could piggyback off that. I was gonna say using the media is a great way to reach elected officials who may be ignoring an issue. And I know Erin's working on a how-to guide with that also. But you know, if they're not listening to you, they definitely read news articles and they definitely have Google alerts set up with their name that comes up. So using media and saying that you've reached out to this elected official who is continuously not, you know, hearing your voice or disregarding it is another tactic that can be used.
Yep.
And just to piggyback on that, Garrett, for those, you know, that are thinking about the lower lifts to start with, and maybe that's social media, just sharing those, you know, stories that are very stigmatizing, those sensational headlines, right? And here we are trying to change the narrative, right? So just to educate even those journalists that are writing about addiction and recovery, and maybe that's, you know, the use of the word addict and junkie, and, you know, talking about families in a negative way. What a low lift to just retweet with, you know, here's a link on how we should be talking about this. And so, you know, many different opportunities with the media. And just, I know we're going over time. A couple things, Erin and Garrett, saving chats. I see some direct messages and I see them and I'm trying to screenshot them. But just remember, when we're done with this, we're going to share our emails. So if we missed a question, it's because we didn't do enough screenshots or maybe we didn't capture it. Please reach out to us and email us with some of your questions. Thank you.
Yes, I think our emails are actually on the last slide if you want to put that up. And so people can, so we can do this, yes, but next slide, there we go. And so if people want to reach out to us individually, that's great. Again, a lot of the questions I think people might have will probably be answered in the follow-up email. And we encourage you, please take that survey. This all really begins with listening to people. And so we want to make sure that if we're going to create something like a family caucus, then it's like we want to do it with family member input.
Yeah.
I want to just guess what people need, right? And I want to thank Denise and Marcia, because last night I was on an advocacy meeting in California, and one of our advocates was just talking about how grateful she was for the coaching piece that you all do and offer, and so anytime that, you know, we can help direct folks towards the tools that you guys have out there, and vice versa. But together, obviously, we have already have like a ton of different tools and resources that are already available for people. So we're just trying to make it a little bit easier for people to have their voice heard and find their path in advocacy. And so, Lisa and Marcia, did you have anything else? I think we're at the hour, so.
Yeah, I think that's a wonderful closing, and thank you for sharing that. You know, as cliche as it sounds, together we can, and we're already just seeing in the last 12 months how our two voices coming together has been so impactful. So we appreciate you as well, and super grateful.
Yes, thank you all so much, and we will have the next training scheduled, and everybody will get the data and the registration for that, and it'll all be in the follow-up email. So thank you all, and everybody, please be safe.
Yeah, thanks for coming, everybody.
Thanks, everybody.
Bye-bye.
Bye-bye.